Welcome back to Your Health in Your Hands, and we've been talking about cardiovascular disease. Now, before we ended our last segment, we talked about 5 main foods or nutrients that you should be having or you should be taking on a regular basis to ensure good cardiovascular health. Vitamin D3. I want to talk about that in a minute. But vitamin C, obviously, you can get vitamin C from fruits, especially oranges, limes, and lemons. Not always enough in enough quantities to give you what you need. So we'll be talking about how to supplement that. L-arginine is an amino acid, which is a protein, is found in certain foods like meat and shrimps. Those may have their problems as well. So we're going to talk about how to supplement that. Magnesium is a mineral. It helps to relax and open up the blood vessels. We'll talk about how you can get that. And of course, omega-3 fatty acids are mainly in fish, in fatty fish, in seafood. So those are the main areas, those are the main foods that you should be getting, the main nutrients you should be getting. I want to start with a small discussion on vitamin D3 because in recent years, in recent decades, the importance of vitamin D3 has really exploded. Come to the limelight. There's a website, you might want to check it out. It's called vitamindcouncil.org. Vitamin D, the letter D, council.org. And this is made up of experts in the field of vitamin D. There are physicians, there are researchers, there are nutritionists, all looking at the importance of vitamin D, not just to heart health, but to brain health, to cancer. And what they are coming up with is very, very revealing. But I want to talk about one particular research because this really bears, is important to what we are talking about here. So a few years ago, there was a study by some researchers of people living in Australia and people living in Scotland because they wanted to find out why people in Scotland had such high rates of heart attacks and strokes, cardiovascular disease, and why people living in Australia didn't have up to half that amount. So what they came up with, what they found out, was that the people living in Australia, especially those who live by the coast and who go to the seaside a lot, and Australians are really good at sunbathing and just exposing their bodies to the sun. What they found out was that because of that exposure, the Aussies, as they like to call themselves, have higher levels of vitamin D3 than the Scots do, who are always inside. As you know, Scotland is very cold, it's up in the northern hemisphere. So they in Scotland were not receiving and getting enough vitamin D. And that was one of the things, if not the most important thing, they pointed to as what's responsible for this disparity in heart attacks and strokes. What does that have to do with Nigerians and black people? Well, you may think that because we live in the tropics, we live near the equator, we're having all the vitamin D we have because the sun is always shining. But think about this. How much time are you spending actually in the sun? I mean, you're probably in an air-conditioned office or living room right now watching this program. You are not really exposing yourself to the sun. You should be barebacked for at least 30 minutes to an hour every single day to get enough vitamin D3 for your body's needs. Number 2 reason why you're not getting vitamin D3 is that you have black skin, and in black skin you have a pigment or a substance called melanin. Go check it out. Melanin tends to block out the effects of the sun rays. It blocks it out. And when it blocks out the effects of the sun rays, you will not be able to get enough vitamin D3. So it's crucial. It's crucial that you understand this. Don't think that because you are black and because you live where there's lots of sun that you're getting enough vitamin D3. You are not. As a matter of fact, what vitamin D3 does is that it produces a gas, like I mentioned. It helps the endothelium, and the endothelium is the inner lining of the blood vessel. It helps the endothelium produce a gas which helps to heal and reverse. It also helps to dilate the blood vessels, but it helps to heal and reverse damage to the lining of the blood vessel. That is key. Now you can research that and you can find that out. Obviously, and I've said this over and over again, that this is not to replace your doctor's attention. You still have to take your medication. You still have to take your blood pressure medications, your cholesterol medications, as your doctor has prescribed. But remember this, those medications do not do what I've just described. They don't clean up and heal the blood vessels. They try to limit the damage, but they do not, as a matter of fact, do not change what has happened here. They leave that to your body to do that. So it's really important that you pay attention to these things. The other things that we mentioned the omega-3s, we mentioned vitamin C. Vitamin C is really important for the health of collagen and the health of the blood vessels. In subsequent programs, we'll probably go into these with some more depth. But stay tuned. Make sure you send in your comments, your questions. We would love to engage with you and help clarify issues for you. So thank you for listening.